Good morning, Enid. Thanks for having us again to the City of Enid. Today, I'm Maggie Jackson, and we're with the Garfield County Health Department, and I brought with me Ray Johnson. She's our health educator, and we have a special guest, Janet Cordell. Yay! Who is, you've probably seen her on here before. She is a community health expert and volunteer and volunteer nurse, and we're excited to hear from her as well.
Thanks.
Today we're going to update you all first in just what's going on with COVID lately, what's happened after the holidays, and then we're going to share with you information about the vaccine, and that is the biggest thing we want to get out there. And then we want to hear just a little bit about our events and how they've gone and how you can volunteer too. So we'll first have Ray. She's going to share with us a little bit about what we've seen with COVID-19 in the last week.
Hi, Enid. If we can share that first slide. So this is just our case count for COVID cases. I do want to start this off by saying since we have the vaccine, that has become the health department's #1 priority. Mm-hmm. So testing appointments are limited. So there is a potential that there are more cases in Enid that aren't being tested just because of the limited testing. We have lots of partners in the community that do take testing. We have Express Wellness, right? You guys please help me with this. CVS, Enid Live Well, Reliant Health and Wellness, is that what it's called? They're doing testing. So lots of places to get tested, but I know a lot of people rely on the health department for that, but right now we are just working as hard as we can to get the vaccine out, and so that does mean limited testing. So that may affect our numbers a little bit. It's still here though, folks. We're still seeing lots of cases. But total confirmed are 5,705. We've had 46 deaths now in Enid. We've had in Garfield County, we've seen 5 deaths in the last 3 weeks, which is just awful over the holidays. We've seen 5,283 recoveries, and we're sitting about 376 active cases. These are the numbers from yesterday. They haven't been shared for today yet. So that's just kind of where we are with COVID cases, and then we're going to talk a little bit about vaccine and phases and how that's all looking.
All right. So, COVID is still happening. We are already ready to give phase 2 in our community. So phase 1, we came to the hospitals. We were able to give vaccine to our nursing homes. There was a federal program where our nursing homes are still getting vaccine. So phase 2, we've opened it up to anyone who is a first responder. So that's our police, our fire, if you are an ambulance, or even if you're a volunteer firefighter, we would like you to be able to get a vaccine. So we know you're exposed potentially, and so that's an important group. Any healthcare worker, so if you work in a dental office or a mental health, we want you to be able to get a vaccine.
Home health and all that.
Yes,
also. Yeah.
Those who take care of people at home as well. And now, this last week, it's been open to people over 65. So we're so glad that we're able to get vaccine out to that important population. So we have not opened it yet to adults under 65 that may have a comorbidity or co-occurring condition. We know that's a very important group too. We're looking to see the state will open that up maybe in the next couple weeks, but we don't have a date when it will be open to you. So right now, only if you are over 65 can we give you a vaccine. That's determined at the state level. So we've done some large events already. We've been so thankful for the Stride Bank Event Center. It's been an amazing venue. They hosted us. We're so thankful. We got lots of people through. Our first event, we did over 700 vaccine. The second one was almost 1,400. So our events have a very high demand. And this week, we posted a sign up, and it filled up in minutes. And so we recognize there are so many people that need and want the vaccine. And so we're doing our best to put it at the top of our list. So it's what our nurses are doing. And we're going to be opening up not just once a week. We're going to be opening up appointments many days of the week. So we will hopefully every day so that we can get so many more people through. What we need everybody to do, even if you're not in those qualified categories, you can go. So I think it's on the next slide. we have vaccinate.oklahoma.gov. This is where we're sending everyone to. This website is a new tool from the state health department that you can pre-enroll. So you enter just basic information. You'll need the demographics, where you live, and what you do. So you need to be able to show, you work in healthcare, or you're a teacher, or you're over 65. It might ask for your insurance, but we're not charging insurance for the vaccine, so don't worry about it. We just want to get your information in. And what it will do is it will have a map for every site in the state that right now it's mostly the health departments and our larger events. It will show where you can go for those appointments. It doesn't mean you can walk in. What it will do, even if you're just pre-enrolled, you will have an email come to you when an appointment is available in your location. So if you live in Major County or Grant County, it might send you closer to those health departments. So please go to that website. Even if you are not over 65, you can still pre-enroll now. And when it opens up to you, then it will send you an email.
A couple things I want to add in about the portal. There's a lot to it. One big issue we're seeing is people are registering, and even if they are eligible, say they're 85, they may get an email that says you were ineligible. That just means that there aren't any appointments available. You are registered, and you will get an email when an appointment is available. Another big issue, I'm trying to think of a lot of the questions we've had about the vaccine portal. They'll come to me. I'll think about it. Yeah.
I have to tell you, I had a friend call me, and she had registered her husband.
Okay.
But she had made a mistake, and she'd put that he was pregnant. So, and he'll know who he is. I'm not going to let him forget that. It would not let her go back and change it.
I remembered what I was going to say. We realize, we see a lot of comments and questions, and we realize that signing up on an online portal may not be the best way for someone that's elderly or needs help. We understand that, but this is going to be the most efficient way to sign people up. So if you can get a friend, a family member, a neighbor that has internet access and can help you register, that's going to be the quickest way to get you the vaccine. That being said, we do realize that this is not for everyone, and there are alternative ways. You can dial the number 211 if you need some help, but that line, people are waiting hours to get through. So your best way is to find someone to help you. If you know of someone that's going to need help, reach out to them, help them get registered, because this is going to, once the kinks get worked out, this will be the most efficient way to get appointments scheduled, and it's getting better by the minute.
Most everybody has a child or a grandchild or somebody that could enroll them.
Yeah.
You know.
So if you're watching on Facebook, I'm sure you have an email. So please reach out, help those vulnerable family members, those that may not have internet or email. We need everyone to come together to help people get enrolled. And we had such a large volume of calls this week. It was just hundreds and thousands of calls. And so we're sorry if you weren't able to get through. We're hoping that this portal, like Ray said, helps us get everybody in the system, and we will have vaccine. We will have it coming. It's coming in shipments every week, and our goal is minimum half of it has to go out the door every week. So we've already given over 8,000 vaccines in our 8-county district. Several thousand here in Enid already. So the vaccine's coming. We just need you to be patient and work with the tools we have to get you signed up. So.
Sorry. One more thing I wanted to add. Some days, if you call the health department and no one's answering, that means we're all out at a different location giving the vaccine. We had our first event on Thursday, the 31st, so we were all out there. The health department was closed. It was closed on Friday for the holiday, and then on Monday, we were at another event giving vaccines. So if you're not able to get through,
that's a big reason.
That's a big reason, is that our staff, we put all hands on deck and everyone is out giving the vaccine. Partially my fault. I should be sharing that news on Facebook if the health department staff is elsewhere, so I will try to be better about that. But we're trying so hard. We are giving this everything we got.
They really are, the health department. I did want to say one thing, and that is one of the things that we're doing. I've had a lot of questions from people who are afraid they might not be able to get their second vaccine. And one of the things that they need to understand is that's a part of the whole process is we don't want to give a lot of first ones and not have vaccines for the second. So you will get your second vaccine.
We're prepared for that.
They're prepared for that, and if you just, it'll be a matter of in registering for it, and then they will let you know. But you will get your second dose. Period.
Yes, we know that's. What we saw from the control trials, the testing of this vaccine is that it's nearly 95% effective for Moderna and Pfizer. So we know that happens after that second dose. So we're working really hard to overlap new vaccine with second doses. So that's part of the logistical challenge.
Well, and one of the things that I have tried to stress to people is that second shot is not a booster. This is a series of 2. To me, booster implies, well, I got the shot, and so I'm going to boost it a little bit. No, this is a series of 2. You only really get full coverage if you get both shots.
That's right. It's so important that people,
regardless of which one you get.
So I wanted to ask Janet to talk to us about, we've had a couple large events and she has stepped in and been a volunteer, has given vaccines. So I wanted to ask her, tell us how those events went.
Well, let me back up and I'm going to tell you about me taking my shot.
Yeah, great.
Okay. First of all, I've been helping with at St. Mary's and at the Stride Center, volunteering. I retired 15 years ago, and now I just work hard at the jobs that don't pay me. But anyway, I participated in the first one at the second one at St. Mary's, which was Pfizer, and I got mine then. I'm due for my second one next Monday. I got my Pfizer, had very, very little reaction to it. Little bit of point tenderness on my arm. I felt fine the next day. One of the things that I've seen, I've had a lot of friends call me and say, well, I kind of had a fever, I kind of did this, but my husband took it and he was fine. So as I say to them, we don't know. Everybody's going to react differently. Some a little more than others, some a lot less.
Yes.
So,
but we want you to expect that you will have some side effects.
You'll have a little something. I mean, if you've ever gotten the flu shot, which hopefully most of you have, for me, I didn't have as much reaction even from this as I did from a flu shot, which I never had much reaction to either, but my arm got a little sore with the flu shot. So I'm looking forward to getting my second one. What I plan to do is when I get my second one, then I will still continue, that'll be the 11th, I will still continue to do exactly what I'm doing now, mask and do all the precautions, till around the 1st of February, a little after. And then I'm not going to still change anything really, except that I might feel, I might be able to get out to the store a little more. I might be able to get out a little more. Still going to wear my mask, still going to do hand washing, still going to do social distancing. Because remember, there are a lot of other people out there that haven't had the shots yet. So, and with the latest news from yesterday that the majority of people spreading it are asymptomatic people, people who don't have any symptoms. So if you don't know you've got it and you're walking around without a mask, you're threatening my health. And I've tried to remember and tell people that wearing a mask protects me. I'm 72 years old. I have COPD. I need some protection. Okay. That being said, being involved in the events have been wonderful. They have been very well run. I am so proud of our health department. And really, Maggie didn't pay me to say this, I promise you. They've been working long hours, long days. I participated in 2 at St. Mary's and 2 at the Stride Center. The first day got off at the Stride Center. I mean, it was a new event. It was a huge number. It got off to a little bit of rocky start. We had to figure out what to do. But once it got going, it was great. And I cannot say how proud I am of us for the way things went on Monday of this week.
Me too.
Monday, we gave, as Maggie said, almost 1,400 doses.
It was over 1,400.
Well, I thought it was closer to 50.
It was. It was closer.
It was closer to 1,500.
Yeah.
And it went so smoothly. If you look on Facebook, I had some friends who came from Stillwater. I had friends who came. I mean, there were people from all over, and every one of them on Facebook posted, and a lot of the Enid people too posted. The wait wasn't very long. People were accommodating. It was just a very, very well-run event. I was very impressed, and there's no reason to suspect that it won't go the same. Now, my understanding is Monday is going to be another full-day one, right?
Yes. So we have an event, it's already filled up. So one of the biggest things for our event on Monday is that we've decided to change the location. So if you're listening on Facebook, please spread the word that the location has to change. I think we have a slide really quick. This is a map of the Oakwood Mall. We're going to be on the northeast corner of the, not the corner, but the side of the Oakwood Mall. And it is, it's on that right side of the map, and so it's where you might have seen Big Lots used to be there, and it is where the Halloween store was.
Yeah, right where that red.
Yes. So when you come, if you know someone coming to the event on Monday, they need to come to that mall entrance that is on that northeast side, not the food court side, the east side. So we want to direct everybody there this time. Please help us spread the word that the event did change from the Stride Center. We've loved the Stride Center, but setting up in the mall will allow us to stay there and be there every day when we get those appointments out there. So
well, and people don't have to walk up the hill.
Yeah.
I'm telling you, that first day, I mean, like I say, I have COPD.
Yeah.
And I tried to park out a little farther. I didn't want to take any of the spots. And walking up that hill, that about did me in. So it's going to be a lot easier for our older people to get around and our more, disabled.
And if you need help at the events, ask for it. We have lots of hands. We have lots of National Guard. They will get you a chair. They will make sure, we want to accommodate everyone, have this be a safe and easy event. And so if you need help, ask for it. We will take care of you.
So also, the City of Enid has promoted free rides to come get your vaccine, and we are so thankful because we know that this is a barrier for some of us. If we can't get a ride, it's hard for us to get the vaccine.
But the rides will be just to and from the shops.
Yep, not everywhere.
No other stops in between
just
there.
for the vaccine. So for that, you can call 580-233-RIDE, RIDE. 233-RIDE. So spread the word that if you know someone that might have a hard time getting there, we're so thankful to the City of Enid for being able to provide that.
Absolutely. Now after Monday then, what's the schedule going to look like?
Right. So Monday is going to be another big event. And then we're going to kind of, we want it to spread out through the week. So we will have appointments available eventually in that vaccinate.oklahoma.gov. That's where you pre-enroll. And our appointments will start to show up as we we have to make sure we have the staff able to do it every day. So those appointments will come up in that system. They may not be there today, but go ahead and pre-enroll at vaccinate.oklahoma.gov. And when an appointment becomes available, you should get an email letting you know there's one in your area. You can also select what radius you're willing to travel. So if something comes up in Guthrie or Stillwater, I think you can select 50 or 100 miles if you're willing to drive.
Correct me if I'm wrong, but I think as we're waiting to make sure we're going to have the vaccine in and the staff available, and then hoping to start daily appointments the week of the 18th. Am I correct?
Right.
Okay.
Okay.
Not next week. The week after is when we'll.
Well, the main reason I wanted to clear that up is because I've been telling everybody, I know we're going to be doing all day Monday throughout January and probably later. So I want to be sure and get that information out. I'm just kind of concerned that and I've promoted that a lot, that people will see, say, a Wednesday morning appointment open on the 20th and go, well, they're not giving these on Wednesdays. So just be prepared for that.
Sure. It's important that people know that they cannot walk in at this point because the vaccine's frozen. So we've got to plan exactly how many people are coming. So please encourage people not to show up. We want them to go to that portal, get pre-enrolled. They'll get a vaccine as soon as it's available, but please don't to show up to the event. I
do want to mention that one of the things that I put a call out for a few weeks ago were, these people have been working all day long. We don't hardly get a lunch break. We do, but but not enough time to run out and get things. So I put a plea out, and I've had some wonderful, wonderful response to that. I've had anonymous donors. Last week, Dr. Barbara Winery and Chick-fil-A, Connie Chick-fil-A furnished stuff. This week it's going to be the Pastry Nook, and my church is going to, and then I know OG&E is going to. I know that the Garfield County Medical Society will. Doctors James and Cindy Rogers and Dr. Don Carnes and his wife. Those are just a few of the ones that I can think of right hand.
Wow.
If anybody is interested, please give me a call or Facebook message me on Facebook, because even when we go to shorter days, it's still going to be a time frame that I just think it's the thing we need to do to help let people understand how much we appreciate it. I do want to say one thing that one of the questions I've been asked many times is, why did you get the shot?
Yes, tell us.
Well,
what makes you, some people aren't sure about it yet.
Yeah,
They're not quite ready.
They're not.
So.
You know, the thing that amazes me is I have a lot of people call me about medical advice, life-threatening medical advice sometimes. And they seem to take that advice. They seem to trust me for that. Some of those same people, when I say, wear your mask and get your shot, for some reason, all of a sudden, they don't trust me.
There's a whole lot of noise around it.
It just amazes me. So, I wear my mask because I believe that it's about the air we breathe. It's important to wipe things down, yes, but it's about the viruses travel. It's about the air we breathe. Why I got my shot? Because I listen to the medical experts nationally. But you know what? I listen to my local medical experts. And if my primary care doctor and my pulmonologist and, lots of other health professionals in the area tell me this is what you need to do, this is what I need to do. I mean, to me, it's not, it's just a no-brainer. National health people and local health experts say this is a thing to do. And I have no doubt that it is the thing to do. So, I'd be happy anytime anybody has any questions. I'd be glad to answer them. But it's what I do. I mean, I need to protect myself, but I also need to protect other people. And the only way we're going to do that is by getting people immunized. I have a really quick, I saw a meme on Facebook. I have to, I talk all the time. I saw a meme, and a lady was showing her smallpox scar. Now, you guys are young enough, you probably don't have smallpox scar. I do. Her smallpox scar to her young child. And the child said, Mom, what's that there? And she said, that's my smallpox vaccine scar. And the little girl said, but Mom, why don't I have one? And Mom says, because I got mine. To me, that pretty much says it all.
Wow, yes.
Yep.
We know with our history, vaccines have been a big part of us having less deaths from infectious disease. So we have just hope that this vaccine, it was developed very quickly, but not without the same safety protocols that are required for all vaccinations. So the same safety procedures were followed.
The thing people need to understand is it is quite different than other ones. Every other vaccination or immunization that I know about were made from either killed or live viruses. Polio was a live virus. A lot of the other ones are killed viruses. The flu is a killed virus. These do not have the component of the virus in it. And I have a degree in biology, and I've studied some genetics. I can't get all this genetic stuff, but it's something about the RNA and altering that. And
so we've heard it's like if you know what Snapchat is, or an email. The messenger RNA is like a little message, and the reason why you might have a fever, you might feel a little bad, achy, or sore the next day is because it's telling your body, this is what the virus looks like. So your cells learn, I need to make this protein to keep the virus from making me sick. So it's then the messenger RNA it goes away. It doesn't come in your cells. It doesn't stay in your body. So it's so fascinating. The science is amazing. I have a biochem major, and I love it. It's so cool. So that's just read for yourself. We recommend, if you're a reader, if you're a researcher, you can go straight to the Moderna or the Pfizer websites and learn about the vaccine. The FDA has some summaries that help you understand what the technology was, how they did the trials, how they know it's 95% effective. So those things, if you're a learner, go check it out. We are happy to share. We've shared already. Ray has shared a lot of quick and easy ways to just understand how it works and what's in it as well. We have seen some people, if you have allergic reactions to medications or to a vaccine in the past.
Especially the vaccines or immunizations.
Yeah, please talk to your physician about that, see what they think. There are people who might have an allergy to something in the vaccine. It's very rare, but it's happened. So make sure you talk to your doctor if you've had an allergic reaction before.
And that's one of the reasons we have people wait for a while right afterwards. We have an EpiPen there. I don't think we've had any reactions.
No. Nope.
And I don't anticipate we will, but we are prepared.
Yes,
if we need.
That's why you come in. If you come to an event, we ask you to prepare for at least about 45 minutes. We may not take that long, but you may have to wait a little bit. Then you go through the vaccine. You have some forms you can fill out ahead of time. And then we ask you to wait for that 15 minutes at least. And if you've had a reaction, you stick around for 30 minutes. Yeah. All right. Well, I have wondered if there were any questions on Facebook too. So Ray's got us pulled up. If there's,
haven't seen any questions.
Okay, great. Anything else that we can share? Just keep going to that vaccinate.oklahoma.gov. That's where you can enroll ahead of time, and you can get an appointment. Will be emailed to you.
But just keep remembering, you're registering. You're not registering for that appointment at that point in time. You're putting your name in the queue so that you will get an email. I think that was the very confusing thing at the very first. On Wednesday, people would register, but they didn't understand that they weren't going to be able to schedule an appointment yet. And my understanding is what happened is a lot of people would register, and then there would be an open appointment time maybe. They would go to that and it would say that it was filled. Well, it wasn't filled, it just wasn't open. So I think that people just need to understand, you are registering to get in the queue, and then you will receive an email about when.
Yeah. If you forget that link, go to the Garfield County Health Department Facebook page. We'll have it kind of pinned at the top so it's easy to find. And,
The other thing is they use that portal now, not the health department one, not the Garfield County Health Department one now.
Yes.
That's
those
because I've had that question.
The sign-up geniuses are gone. If you had an appointment through a sign-up genius, your appointment will be honored on Monday. But if you've had a vaccine in the past, and you're ready for your second dose, you need to register through vaccinate.oklahoma.gov.
Yes.
I did think of one more thing. So Jana is here as a volunteer. She is retired, and we're so beyond thankful. We've had some amazing volunteers. If you, we're all hands on deck. We could use some extra hands. If you are a healthcare provider, a nurse, or another healthcare person, we utilize the Medical Reserve Corps.
Yeah, Oklahoma Medical Reserve Corps. And I noticed a lot of National Guard people too. I'm a member of the Oklahoma Medical Reserve Corps. You do not have to be a medical person to do that.
Yes, I'm signed up.
You can sign up for that. Interestingly, I've been an OKMRC member for a long, long time, but I never really did a lot with MRC because I also do disaster health services with the Red Cross.
Yeah.
So I was always doing that this is one time that I have been very protective of myself. My kids have been protective of me too during the whole pandemic. But when I learned a few months ago that we were going to be starting to do this, I said, I haven't been able to do much in-person stuff. I've done a lot of virtual stuff with the Red Cross, but I've not been able to do in-person stuff. I can put on a mask and I can go give a shot, by golly. So that's my contribution. But
we're so thankful.
About the Oklahoma Medical Reserve Corps, OMRC. OKMRC. .org. Go there and sign up. It's the thing about it is, if you sign up there, if you are a healthcare professional, you will be vetted. They will do a background check. You know, so many times people show up at events. We see this a lot with the Red Cross. They show up and want to volunteer. They show up at a Red Cross shelter and say, well, I'm a nurse.
Yeah.
Well, I don't have time to stop in the
to
middle of that
double
and
check,
vet
yes.
you. So,
Yeah.
and Medical Reserve, of course, the same way. Go and sign up. You may never not do much with it, but get your background check, get vetted, and then you have that opportunity. Same way with the Red Cross, redcross.org. I got to put that plug in.
Yes, absolutely.
Okay. Anyway, that's yes, we do need volunteers. We need traffic control. Just people. Remember, we're working now with people over 65.
So some
Many of them
helpers
need
would be
some
great.
assistance.
Yep.
And so I would say the more volunteers, the merrier. So
Yes, thank you, Janet.
Yes.
OKMRC.org. We're so thankful for all our volunteers
Yes.
and other partners. I just want to say the City of Enid.
Oh,
Enid Public
absolutely.
Schools has helped us with the chairs and tables today.
Yes.
We've had the Garfield County and Enid, City of Enid Emergency Management, the Sheriff's Office, the Enid Police. We could
Life
not have done
EMS.
this. Say that again.
Life EMS.
Life
Life,
EMS,
yeah.
yes.
Oh,
We
yes.
have
Yeah.
had so many wonderful partners, as well as Integris Bass Hospital and St. Mary's
St. Mary's,
Hospital.
you
They
bet.
have vaccinated, EMS providers and their own staff. They're helping us store vaccine. We're so thankful to all
Yes.
of our partners in this community.
I did think of one more thing to add
Go.
about vaccine. Eventually, the health department is not going to be the only place to get the vaccine.
Absolutely.
When supply is plentiful, we have lots of vaccine partners at doctors' offices,
Yes.
pharmacies, and you will be able to get your shot there. This is just how it kind of goes in the
But-
initial.
But what they need to understand is, when, like you said, it is frozen, regardless of which one it's frozen. It takes a while to thaw it out, even though we found some ingenious ways to thaw it out. Our armpits are awfully warm sometimes. Anyway, long story short, the problem, the only issue with getting it into doctors' offices sooner is, once you thaw that vial out and reconstitute it, it's a 10-dose vial.
Yes.
They have to be used within 6 hours.
Yes.
Unfortunately, especially smaller areas, that may not be possible.
We have
for a
to
while.
make sure we get all
Yeah,
those doses
you got. I
used.
mean, you don't want to waste any of those. Those are too precious to waste. So that's one of the intricacies of the end of the day for us at the sites is, how many more people do we have out there? How many more vials do we need to open up? We don't want to open up. I mean, if we have one person in line, we're probably not going to reconstitute a vial.
We'll find some others maybe, but
We'll find
they
some
have to be
others to come,
qualified still.
or we'll have that person come back and be first in line the next day if it's, if that's possible. So just understand that it's not like the flu vaccine,
Yeah.
where you get a multi-dose vial, you don't have to reconstitute it, you draw up a dose, you put it back in the fridge. It's good for a few months or more. There's some very strict. Now, when they come out with some of the newer ones, maybe not so much. That's just one of the things we have to watch for.
Yes, thank you, Janet. So just in summary, we have lots of challenges with getting it out, but we're up to it. This is what public health is good at. We are so privileged and excited to help our community have this tool to turn
Exactly.
COVID-19 the other way. We're just, we're doing all we can with social distancing and masks, but we're hoping the next few months, things start looking up and we see less folks in the hospital and less folks dying. So thank you for your patience with us as we all figure this out, and thank you to everyone who's willing to get the vaccine. You guys
Absolutely.
are, taking part in that herd immunity that we all want
Absolutely.
so badly. So, thank you for listening, and Jan and Ray for Janet, sorry, helping us share good information. So, thank you, City of Enid.
Yes, thank you.
We appreciate this partnership so much. So, you all have a great weekend, and
Wear your mask and get your shot.
wash your hands.
Yeah.
Watch your
Wash your hands.
distance.
Don't touch your face.
All right. Thanks, Enid.
Bye.